New overnight, the government is shut down. Senators blocked a House-approved continuing resolution that would have paid the bills through mid-February. Now, the White House says it won't reopen immigration talks until Congress reopens the government. Democrats were holding out for a comprehensive spending bill and a deal to protect the so-called dreamers who were brought to the U.S. illegally as children.
The birth of a child is a time that should be joyous for families, but in Arkansas, a record number of babies are being born addicted to drugs. That's according to a new study released by the Arkansas Department of Health.
And tonight, 11 News investigator Winnie Wright looks into what got us to this point and what needs to be changed.
We've all seen the videos of babies born during the crack cocaine epidemic, their tiny bodies withdrawing from drugs.
Some of these babies, quite frankly, are going to come in dead.
The number of Arkansas babies born with neonatal abstinence syndrome, or NAS, increased more than tenfold between 2000 and 2014. The ADH study that found those numbers puts a lot of the blame on the growing opioid epidemic.
These drugs are so addictive.
Dr. Whit Hall treats those infants at UAMS. He says the stats are much higher in their unit.
Studies have shown that some form of substance use disorder is present in as much as 5% of babies, which is 10 times 5 per 1,000.
Babies suffering from NAS have to stay in the hospital longer for treatment. That often means more exposure to opioids.
Not only is it difficult on the babies, but it's also difficult on the taxpayer as well.
NAS babies are typically in the hospital for 2 to 3 weeks.
The costs nationwide are $1.5 to $2 billion annually. It's a huge expense. Mostly it's public insurance that we the people have to pay.
A major concern for doctors is, unlike with babies withdrawing from meth or cocaine, where symptoms begin shortly after birth, Dr. Hall says opioid withdrawal symptoms may not surface for 5 to 7 days, meaning the babies are home and not under a doctor's care.
You can only imagine that a mother who is on opiates and has a baby that comes home and becomes irritable and either is inadequately treated or has a severe case of neonatal abstinence syndrome and is very, very irritable, that baby is going to be at very high risk for subsequent physical abuse.
Many NAS mothers won't take their babies in for treatment, so the numbers could be much higher than we realize.
I think it's a lot of just fear that they have in getting treatment because they feel like they're going to be judged, or that they're not going to be taken seriously, or that they will get in trouble with either the legal system or with DHS.
Dr. Jessica Coker is a psychiatrist who treats pregnant users.
Ideally, even getting them before they become pregnant is the best scenario, because the very first few weeks of pregnancy is very important for brain development and spinal cord development.
But that's not always the case.
We know that around 5% of women continue to use illicit substances off the street while they're pregnant. So in Arkansas, that equates to about 1,500 pregnant women every year.
Her department at UAMS offers medication-assisted treatment during pregnancy. The women are provided with a drug like methadone to help wean themselves, as well as OB/GYN care and a support system they may not have had otherwise.
That risk is less than the risk of them continuing to use off the street and not taking care of their pregnancies and not seeing their obstetric provider.
While the short-term effects are jarring, both doctors share grave concerns about the long-term effects.
There's no question really, but these exposure to these drugs can affect the long-term neurodevelopmental outcome of these infants.
It's the effects later in life that most concern Dr. Alan Mees, Medical Director of Child and Adolescent Health at ADH.
Toxic stress, early life adversity, changes the expression of your DNA. So then you get into the DNA and the genetic aspects of this.
Dr. Mees says drug-addicted mothers can have a hard time attaching to their babies, can be abusive and neglectful. All causes, he says, that have equally disturbing effects on development.
A mother who's on drugs is not going to be able to establish a secure attachment relationship with a baby. Babies need security in the social emotional development area, without which their brains can't develop. And they'll wind up being the kid who gets thrown out of preschool for aggressive behavior. A kid who can't do well in school.
Children exposed to toxic stress, Dr. Mees says, have higher chances of developing chronic disease, and their life expectancy is decreased.
Arkansas is the highest state in early life adversity.
All 3 doctors agree treatment works, and the sooner the better.
I think at the heart of it, moms want to be good moms.
UAMS is making a big push to work with OB providers to let them know about their services available for addicted mothers, and also telemedicine so patients don't have to drive to Little Rock for help.
Generally speaking, mothers who agree to either go into treatment and to admit to their drug use and admit that they have a problem, these mothers are much less likely to have any adverse consequences at all.
While it may seem counterproductive, Dr. Hall says it's extremely important these mothers breastfeed.
The reason for that is that some of the opiates get into the breast milk so the babies can gradually withdraw themselves.
If users think they may be pregnant or if their babies are showing signs of NAS, the doctors say it is critical these women seek help. In Little Rock, Winnie Wright, THV 11 News.
Now, if you think you may be pregnant and are using drugs, Dr. Coker encourages women to call their office. They'll typically get you scheduled the next day. We have the contact information on our website.
UAMS researchers are currently working on a project to study the effects of opioids on a fetus. The goal is to understand which babies may be at a higher risk for negative outcomes.